Good afternoon, everyone. I'm Maura Rin, Chair of the Department of Psychiatry and Behavioral Sciences, and I'd like to welcome you to the second webinar in the Taking Care of Yourself and Your Loved One series. This series is designed to help support the mental health and well-being of our faculty, staff, trainees, and students. Today's topic is identifying and managing alcohol and substance misuse. As we've seen in our clinics, as well as in research over the past year, drinking and substance use have been on the rise during the pandemic as people look for ways to cope with stress and challenging emotions. Today, one of our faculty members, Jennifer Plum Villadarga, is going to share with us the signs of substance use problems and provide guidance on when to seek help and how to get help. Dr. Jennifer Plum Villadarga is assistant professor in the Department of Psychiatry and Behavioral Sciences and a licensed psychologist. Prior to coming to Duke, she worked in the VA system completing a fellowship in co-occurring disorders at the Center of Excellence in Substance Abuse Treatment and Education at the VA Puget Sound Healthcare System in Seattle, Washington. Dr. Plum Villadarga specializes in behavioral approaches such as acceptance and commitment therapy, and she has expertise in treating substance use disorders as well as a range of mental and health conditions. She also conducts research on behavioral management of persistent pain. Dr. Plum Villadarga supervises learners in the Health Risk Behavior Management in the Duke Clinical Psychology Internship Program. Please use the Q&A feature at the bottom of your screen to ask a question at any time during the webinar. We will hold all questions until the end of the presentation, and we'll try to get to as many of them as the time allows us. Please note that you have the option to ask a question anonymously. So please join me in welcoming Dr. Plum Villadarga, and thank you for being here today, and I'll turn it over to you.
Thank you. All right, so without further ado, notwithstanding any future technical problems, I'm really excited to be here talking with you today about how to identify substance use issues and how to really manage them. And we're all under chronic stress. So of course you can imagine that this is even more of an issue and a problem that we have to address together. So just briefly for folks who aren't familiar, substance use disorders are a biopsychosocial problem that's susceptible to stress like many. We know that substances tap into our reward pathways in the brain, and they provide immediate, intense, and reliable reinforcers, which is something many of us would probably want in a difficult time of stress. People turn to substances to manage other mental health or health conditions, and certainly any instability in all of the areas of finances, social, cultural, occupational, and family stress can certainly contribute to maintenance of substance use problems. And unfortunately, we find ourselves in the COVID perfect storm, right? We are all under chronic stress from additional isolation, financial, educational, social, cultural strains. And we're all finding that it's more challenging and there's less opportunity to find ways to cope with stress and to find alternative behaviors that can compete with substances, right? So if we're looking for alternatives to misuse, it's much more challenging to get out and do something else. We're also finding that our previous coping skills are less effective under chronic stress. We have to work harder to figure out how those coping skills that we used before can bring us the same sense of meaning and joy. And unfortunately, some people might feel like, well, here's a really stressful time. Why would I bother to try to cut back or change a behavior that's working for me in the immediate moment when there's so much stress happening around me and it doesn't look like that's going to change in the immediate future? So it is really a perfect storm. Another unfortunate piece that COVID has to bring to the table is that there's an unfortunate interaction between substance misuse, and COVID infection. The research is pretty scary to show that chronic substance use, particularly that of opiates and alcohol, among others, including tobacco, but opiates and alcohol are up there, are actually increasing people's risk for infection from COVID and infection and death and complications. Why? We think respiratory depressants are lowering people's ability to cope with the COVID infection, and for particularly alcohol, that does tend to affect multi-systems and create vulnerabilities there for infections in general, that those are some of the reasons why we may be seeing an increase. And unfortunately, racial disparities, particularly for people of color, Black Americans, are unfortunately found here as well, both for substance misuse as well as COVID infection. So there's really an unfortunate storm here where we really need to be paying attention and seeing what we can do to mitigate the complicating factors of COVID when it comes to substance misuse. So how do we know if substance use may be a problem? Well, we have some indicators from the diagnostic manual that I can go through with some kind of take-home questions. I'm going to go through them fairly quickly and you'll have these to refer back to. But essentially, are people taking more to get the same effect? Are people going into withdrawal, even if it's not an acute withdrawal or a withdrawal that requires medical attention, feeling really crummy or having lots of feelings the next day or after using that are really bringing people down, and craving, wanting or needing urges, having urges to use more are signs that substance use may be becoming a problem. People find themselves using more than they intended over longer periods of time. And then many people with substance use problems may find that they're failing at deals with themselves. Well, I won't drink tonight, and then they end up drinking, or I won't drink this weekend, and then they end up drinking, or I won't use tonight, and then they end up using, or they use more than they planned. They might say, I'm only going to use this much, and then they may end up using more or needing more quickly. And then also people might find that their routines become kind of characterized by when am I going to drink or use? When am I going to get access to that substance? And really kind of planning the day around substance use. Or people might be missing work, feeling hungover, or really sort of having some other impacts in terms of recovering from substances. Of course, we can imagine that relationships are going to be strained if a loved one is using. And so one way this may show up for an individual who's misusing would be other people bugging you about it. Are people saying, hey, I'm worried about you having that second, third, fourth, fifth glass of wine. I'm worried about you drinking again. I'm worried about you smoking more. I'm worried about this. I'm worried that you're really liking those pain pills more than you used to. Are people bugging you? And worsening psychological or physical health. Some folks who are struggling with substances may continue to use even if they know it's worsening a health condition or worsening their mood, their stress, or overall well-being. And certainly we can see persistent social issues, right? So legal issues or risky behavior, that might be just something as simple as recognizing to yourself, I might be going against my own ethics here for what I'm doing to obtain access to substances, or lying about substance use to try to cover up kind of my use of that substance, or just driving under the influence or other risky things. Certainly purchasing illicit substances can get you in trouble legally. So these issues can persist. Financial issues. Sometimes people are just surprised at how much, if they actually went back and calculate how much they've actually spent on, say, alcohol or other substances in a given month or year, and then think about what they're not spending that money on. And certainly employment issues if substance use gets intense enough. And really, a substance use disorder can be diagnosed if that use persists, even with these issues over a year. So additional questions to ask. I'm a behaviorist, so I really want to think about functional analysis here and empower people to think about this in fairly simple terms. Essentially, what we're looking for is, do we have narrow or inflexible patterns of behavior? Do people respond to substances as a have to versus a choice? Their routines are about substances. Or are their behaviors more flexible? Do we have more options for how we can behave under stress? And we can also choose, maybe I don't need to have that glass of wine tonight. Maybe I'll do something with my family, or we'll read a book, or we'll watch a movie. And can we have more flexibility in which behaviors we're choosing and under what circumstances? So some additional questions that might be helpful to think about is kind of asking if yourself or having people we love kind of think about, what is the substance doing for you? Folks who struggle with substance use problems will say that they may use for good and for good reasons, celebrations, as well as other responses to stress or difficult experiences. So many people will say that they'll drink or smoke to fall asleep, but I have sleep specialists, I'm sure, who are attending some of our calls, who will tell you that is not good sleep. You're not actually getting restful sleep in the way that you're going to feel rejuvenated in the morning. Many people will drink or use to respond to stress, their mood, their overall health, or pain management, whether that's an opiate or other substances like alcohol or others, or marijuana, which is currently not legal in our state. And then thinking about, what does it get you? What do you get from doing that substance? A short-term reinforcer, a short-term escape. What is avoided then? So really being able to explore or be aware that there may be something important to avoid, a grief, a loss, a stress that's more difficult to think about. How much of your energy is about substances, right? So a lot of times people can kind of relate to this idea of, maybe it's sneaking up on me. Kind of like a streaming show might go from one episode to the next. Did you find that you're going from the next drink to the next drink, or the next puff, or the next use to the next? Do you feel like it's kind of taken on a life of its own, where even if before it was a way to relax, now it's turning into something else? And where do you want your energy to go? Do you need substances to get you through the day or night? Do you need them more than you'd like? And are you doing other things? Are you taking care of yourself in other ways? Many people who are misusing substances may find that they might skip a meal. They might not drink as much water, and they might change their sleep and exercise routines or not have them. And so thinking about, are those routines getting affected? And really, what have you given up or lost due to substances? This is a tricky question because it can bring shame to the table. But really thinking about, I'm not fixing something in my house or doing this thing for my child because we just don't have the money because I've spent it on substances. So the good news is that the evidence supports many, many paths for recovery. So this is something I really want to provide an element of hope here. And people might say, well, how do I know where to start? And I think a good question people will often ask is, do I need to stop or just cut back? Some people get to a place of, I just know I need to stop pretty quickly. Others are considering that for a while. So I would say, try it out and see. Can you live a full life doing the things you want and still use? Or does using still cost you things? And if it does, consider a trial of abstinence. And a trial means give it a try, see how it goes. You may need to get support to do that. If you're really worried about, if you need additional support to come down from a substance, or you may be worried about needing detox, or you just want additional support, get a professional assessment to help you figure out what's the best level of care. And I'll go over those in a moment. But be aware that stopping cold turkey can be dangerous for some substances, for opiates, alcohol, and depending on the severity of use, the chronicity of use, the amounts used. So that's why a professional assessment can really help you determine if it is safe to stop on your own, or if you need to do something else, whether that's medically assisted detox or a taper recommended by a provider. But if you are going to do detox, leverage that. Right in that moment where you've got some clarity from the substance in your brain, get into some kind of support system, support network, community to help you. And also just consider that there's many routes here. Not all substances are equal. I've been speaking more about substances that get in the way of daily functioning, causing intoxication. But tobacco use disorder is pervasive and problematic. And that's something that's both something you can begin to address even in a primary care interaction, or if you're seeking therapy, you can make that part of your therapist's goals. But it also is, nicotine is one of the hardest substances to stop using because of its addictive potential. So it's not uncommon to seek support, and we have great supports here at Duke and in the community to do so. So just a brief overview of levels of care, just so people have a sense of, what does substance use care look like? What are some of my options if I were going to look to get some support for cutting back or quitting? So the first level of care I would say is actually peer support. And actually the evidence is pretty good that peer support can be a very, very helpful method of recovery on its own, or absolutely in combination with other levels of professional care. Peer support has one of the best pieces to it is that you can go anywhere, you can go anytime. It's virtual now, but it provides a social support network for positive emotional support amongst people who are committed to not using, or at least be honest about their use. And so that really it's about creating a new community of people who are about being clean and sober. I would say traditional outpatient therapy and counseling and medication management is sort of standard, what people might think about. That can be an individual or group. It's often weekly, sometimes a little bit more intensively than that. sometimes when people are using substances more heavily, it might be helpful to do a more intensive treatment program, like an intensive outpatient program or a partial hospitalization program. The differences between the two are negligible. It's often just a few hours difference in a week, but they do pay differently. They do charge differently depending on the model. But it's essentially more intensive therapy. So you might be going to groups and have individual meetings a few hours a day, a few days a week, to help you kind of create new habits and understand what your substance use is about and to begin to address it. Residential care may be needed for folks who really have a serious substance use, or you may really need that break from substances to kind of give your brain a chance to reset and for you to learn some new skills. And often as a step down for people who've had really serious use, they might have a transitional living environment. Essentially, the more information a professional can get from you about what your substance use is looking like, the better. And most often, the more severe treatment is recommended for folks who are really struggling with or who have failed at a lower level of care. So in what to look for, there's no shortage of providers who offer substance use who may have different models, but I wanted to put a couple of pieces in front of you about things that you might look for. Essentially, behavioral treatments are up there in the list for evidence, and there are several with our lovely acronyms here. So for folks who aren't as familiar with them, that's cognitive behavioral therapy, dialectical behavioral therapy, or acceptance and commitment therapy are just a few of our behavioral treatments. There are others. Relapse prevention is incredibly evidence-based as well, with or without a mindfulness component. Contingency management is a gold standard treatment, especially for stimulants. Essentially, you kind of earn points or even money for not using for substances that are pretty pervasive and really difficult to change or stop using on their own. Family therapy is important sometimes in family systems who are struggling to manage use, and even 12-step facilitation, which the 12-step model is often what is in AA. It can be either abstinence-based or harm reduction. Just wanted to make a note that harm reduction can be very powerful at an individual level to help people sort of see if they need an abstinence-based approach. But harm reduction would be like limiting your use and seeing if you can stick to that as a plan and a meaningful, safe life with some substance use on board. In terms of medication management, I am a psychologist. I'm not a prescriber and I'm not a physician. However, I do think it's helpful for people to be informed what they might expect. So opiate replacement therapy is a gold standard treatment for opiate use disorder. It is incredibly powerful and can really help people get back onto a path of recovery. Methadone maintenance programs are especially helpful for folks who have really serious, chronic, often IV heroin use, but they are really helpful. But there's also other abstinence support medications that I'd like people to be aware of to start asking their providers about, whether that's a primary care provider or a specialist who can provide consultation as to whether medications are appropriate and safe. But the evidence is strong that you can take a medication like naltrexone to reduce craving for alcohol or cocaine, and other supports can be very powerful for stopping other substances. So I want to come back to this idea of peer support. Peer support can be a powerful element in a recovery plan, and I wanted to give folks some information about two peer support models that people may not be aware of and give some information on. So 12-step programs, Alcoholics Anonymous, Narcotics Anonymous, Al-Anon for families, they're popular, they're easy to access, and it provides a sober support community. And evidence, actually a very, very good review recently, shows that they can work well alone or in conjunction with other treatments. And Smart Recovery, which is one people may not be as aware of, is actually also very common in our area here in the Durham area, but it's more of a cognitive behavioral approach. There's no formal sponsor, but it does provide a peer model with groups to help people. And it can also be a nice alternative if elements of the 12-step program don't appeal. And peer support is virtual right now. So I wanted to talk a little bit about some principles of recovery across programs. You're going to find many, many different models and methods of recovery because the research shows there's a lot of different ways that you can approach this, but some take-home ideas about how to manage stress and what you might expect in a program. First of all, stimulus control. Don't have it around. Don't be around it. That might be helpful in that you're probably not going to a bar right now, or very few of us are actually spending a lot of time in bars. And at least in the beginning, just don't be around it. Don't test yourself. If you're freshly clean from alcohol, don't go into bars. Don't test it. Give yourself a break from being around the substance. That may mean changing your peer group. Identify the functions of use for you. Your triggers is what's often said. Is it boredom, anxiety, depression? What is it? And you may consider mental health support. Even if a professional counselor doesn't consider themselves an addiction specialist, many counselors will feel comfortable working with folks who are working on abstinence because they know how to address the other pieces. Boredom, anxiety, depression, relationship stress, trauma. We know how to deal with that in therapy, whether someone identifies as an addiction specialist or not. Really, we want to be building alternative behaviors to compete with substances. And something to be aware of is, depending on the substance, no one thing is really going to be able to compete with that substance. For heroin, it has a reinforcing quality, a reward quality in the brain, stronger than an orgasm. So it's very, very difficult to compete. So you have to think about adding a lot of regular alternatives to use to even begin to sort of, to borrow from a DBT model, kind of create a life that feels worth living that's without substances. Assume a relapse can happen and plan for it, prepare for it. That's why I really like the relapse prevention model. Not to say that it will or give it an excuse, but just to say, what's happened? That stressor happens. We haven't, but use it as an opportunity for learning. We can always learn a lot when we notice, gee, I really was, gosh, I didn't think boredom was a trigger, but actually it is now that I realized I drank after I was feeling bored. Finding clean and sober support. I know that's a challenge when we're more isolated. So I would say online is better than nothing. And if there are small ways we can engage with people who are positive, helpful influences, let's find a way to do it, whether that's more text messages, audio messages, or phone calls, maybe more Zoom, although Zoom is challenging. Also, something you may see across programs and is important to remember for recovery is just focus on today. Just this moment. That's really consistent with what's often said in AA about this idea of just get through a day at a time, just a day at a time. Today I won't drink, today I won't use. That could be also through a focus on mindfulness, trying to really gain reinforcing properties from being in this moment, just as it is. Learning how to be here now is really important. Managing expectations, however, I think is important. When you've been using substances to manage your feelings for a long time, you're going to start feeling those feelings when you stop using, and you may notice that there are some consequences you have to clean up. Also, our reward pathways in our brain sometimes sort of stop working and doing their job when we've been using substances for a while, and it may take a while to come back. People may gain weight or crave sugar if they change their substance use patterns. So just kind of being aware of some of the hard things that are likely to come along for the ride. And then really important, I think, especially now, is this idea of really paying attention to what matters. What are our values? What do we want to stand for? What can I do that's important and meaningful to me today, even in these small ways? Building small, consistent patterns of valued action. Get creative. Stay focused on what you can build, not just what is missing. Very briefly, I wanted to cover some supports for families. The idea of interventions are challenging, so shame and blame just doesn't work, but do set clear boundaries and expectations. This is what I'd like to see on this timeline. Let's move on that together. Let's align together to manage this. Give more attention to the behaviors you want to see. Engage more with the person when they're not using. Walk away if they're intoxicated. Keep yourself safe. Walk away. Watch out for enabling use. Kind of let them suffer the natural consequences to the degree that that's safe. If someone is using, don't make excuses for them. Don't pick up their mats. Be prepared. I'll go into this in a moment, the idea of naloxone rescue kits, but really using opiate reversal drugs, having access to that. There's a really easy way to get that locally. And get support and take care of yourself if it's a family member that's struggling with substances. You may need your own counseling or find that you have support in Al-Anon. So essentially some take-home recovery tips. Again, remembering there are many paths to recovery, and it's often true that multiple options, peer support, individual support, medication management fosters success. And whichever path you choose, be engaged in it. That's key. Recovery is a process, and be persistent. And then I have some listed resources for you here.
Thank you so much. That was excellent. And just given that we lost a couple of minutes, every minute's cow. I am going to try to do one question, if that's okay, Jennifer. It's a really good question.
Yes.
What are some of the good ways to address patient concerns about confidentiality regarding treatment, especially licensed professionals?
So how do we address concerns about confidentiality? Well, So one of the things is, there can be confidential forms of care. If it's a professional who's worried about that, there are treatment programs specifically designed for professionals. At Duke, we have professional supports right here that you can seek. And there are levels of security within the notes we write in Duke about those things. So I hope that helps address your question.
Thank you so much, Jennifer. Again, this was really an excellent, excellent talk. Unfortunately, we're not going to have our typical closing with more information today because I know how busy everyone is. We want to be able to finish. I see another question. Nope, we're good. Thank you so much for attending today. I do want to mention in 2 weeks, we have our next webinar, which will be on March 17th, the same time. We have a webinar webpage for you to check out where we're putting the recordings and the presentations. And so the next one is with Dr. David Goldston, discussing, again, substance use and adolescence. So sort of looking at our younger population. And please, we have some resources that we've put in the chat box. Please reach out if we can be of any help or anything that we can do to support you. And please take care and be well. And again, many thanks to Dr. Jennifer Plum-Voladarga for her presentation today. We so appreciate it.
Thank you. Take care.